Hi, I'm Joe Roth. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and informing people about our life-saving mission. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Aduabto has been provided by New Jersey's credit unions, banking you can trust, the New Jersey Education Association, working for great public schools for every child, New Jersey Natural Gas, proud to support education in our communities, United Water, making the planet sustainable is the best job on earth, New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation, and by the Healthcare Foundation of New Jersey, founded by the Jewish community. Additional support provided by the 2014 Special Olympics USA Games. Promotional support provided by the Star Ledger, powering NJ.com, and by Commerce Magazine.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Hi, I'm Steve Aduabto. This is One-on-One. Let's introduce for the, 12 times been on with us, but an important story to tell. Barry Ostrowsky, President and Chief Executive Officer of Barnabas Health. Good to see you, Barry.
Great to be here. Thanks, Steve.
So many things to talk about. One of the first ones I want to talk about is the Special Olympics initiative. Special Olympics 2014, USA Games, Barnabas Health as a founding partner. What is it, and why is it so important as we show some pictures?
Well, it's incredibly exciting for us. As you know, the nation comes to New Jersey to have the Special Olympics starting June 14th of this year. And we believe, as a community organization that's dedicated to all the constituencies that we treat, those with intellectual disabilities are those that are frequently overlooked in terms of health care and social support. So the opportunity to be a founding partner of these national games,
looking at these kids right now,
is very special for us. And I don't think, in my experience, we've ever announced an initiative that has so galvanized our employees with such excitement.
How so?
All of them want to be volunteers. Each and every one of them has or knows a story that affects them in some very special way about an intellectually disabled person or a Special Olympic athlete. And so we are celebrating our commitment literally every month. Opening day is June 14th. So on the 14th of every month leading up to June 14th, we're having a Special Olympics Day at each of our facilities. We kicked it off in January.
That's right.
We raised the Olympic flag at each of our facilities, and there was incredible embrace by our employees, our volunteers who volunteer at hospitals want to be volunteers for the games. But I think it's all an extension of our mission.
At Barnabas Health.
At Barnabas Health. You know, I admire so the major corporations of this country when they dedicate them time and resources to special organizations. In our case, it's what we do for a living. And to be able to shift some of those energies to an organization like Special Olympics and these national games, we just see that as an extension of who we are.
And by the way, folks, One-on-One is, in fact, a media sponsor of these games. If you go on the website that we'll be putting up in just a moment, you'll see us there. And the reason is we are featuring the games. We have public service announcements that you'll see up there. We're featuring T.J. Nelligan, who is the driver behind a lot of this. He was just on our sister program, Life and Living, with Joanna Gagos, our anchor there. He was just featured there. We are going to be doing everything we can to promote those games. It is a once-in-a-lifetime opportunity. It's a big deal.
And we thank you for that, Steve. I mean, that's very important. I think the whole idea behind the Special Olympics, as it was originally conceived by the Shrivers, was to bring notice to those with intellectual disabilities.
Sergeant Shriver, Eunice Shriver, the Kennedys.
Eunice Shriver's sister, who of course was intellectually disabled. And now Tim Shriver is the international chairman.
Right.
But it's all about having us focus on a demographic of special people who really need support, and the families so welcome the support that so many of us give to special athletes. It's a feel-good story, but it's an incredible organization and a wonderful initiative.
Before we leave that, Jackie, could you put up the shot of the raising of the flag, which is really great? I think Barry was in that shot. Yeah, that's a good one.
Yeah.
It's listen, by the way, that's Sean over on the right.
That's right.
Sean Nelligan, who is TJ's son. Listen, It's a great day. Find out more information. Log on the website because they always need volunteers. Shift gears.
Yes, sir.
Want to talk healthcare?
Not unless I have to.
But before we do that, let's talk diversity.
Okay.
Because we talk Special Olympics. That's a part of
Absolutely.
the diversity initiative. At Barnabas Health, I know diversity is a huge initiative. What does it actually mean to have a diversity initiative, and break it down so that people watching can say, oh, that matters to me?
I think it should matter to all of us. Obviously, if you get back again to our mission of treating everyone, we have to make sure that not only are we effective for each of the demographics and constituencies that we treat, but we have to encourage within our own organization that those of various cultures, races, religions have the opportunity to map out a career path that's both great for them and their families. And you have to take special steps to ensure that you have all the support mechanisms that are tailored and designed for those constituencies. Big organizations tend to move by momentum, and you have to stop that momentum and say, are we directing a sufficient amount of our energies and resources to ensuring equal opportunity among all of our employees? So inside the organization, we're very much geared to both minority support and diversity support. Last year we kicked off our Women's Leadership Council.
Sure.
Now 78% of our employees are women, and yet they're underrepresented in the management and executive ranks of our organization.
What do you do about that, Barry?
Well, I think what you do is you gather up those who have the interest in becoming executives or managers, and you map out opportunities for education and support. And networking is a very big thing. You know, many of these folks, whether they're women or other minorities, tend to suffer a little bit individually or are frustrated about lack of progress. So here, if you put everybody together and you get the right type of support and people who understand business and business advancement, you will see, and I saw at the initial kickoff, such enthusiasm among the women in this leadership council to try to teach one another and support one another as they go through the ranks. From an external standpoint, because we're in every demographic in the state of New Jersey.
By the way, let folks know how big Barnabas Health is and where you are.
Well, we are the biggest in New Jersey. We have over 18,000 employees, and we treat 2 million patients a year. And so we're in inner cities and in suburbs, more rural areas. We're in areas that are dominated by senior citizens. So we understand, at least by virtue of our treating, that we touch the lives of people from literally every race, creed, culture. We also need to be able to support the business communities that are representing those constituencies. So we have a minority business program where we try to encourage doing business among vendors who are in fact owned by minority ownership interests.
That takes a concerted effort.
It really does. It doesn't happen without that kind of concerted effort. And there are great leaders in this. We happen to be fortunate in Essex County. We have a county executive, Joe DiVincenzo, who has been iconic in this area. He's insisted on doing greater amounts of business with minority-owned companies, and we have just partnered with the county, thanks to Joe's leadership, to become part of that initiative. And so I look forward to continuing the growth for everyone. We are, in fact, mission-driven. And so as a mission-driven organization, it's important that we pay attention to those who seek to improve their own lives and sometimes, hit obstacles that an organization like ours can help them overcome. And that's really what we're doing.
I'm going to give Barry 1 minute on this because you can often hear Barry with our sister program, NJ TV News, with our colleague Mike Schneider, who's actually coming on for one-on-one interview. He's in the green room coming on after this. You can hear Barry with Mike talking about the ongoing efforts with Obamacare and the implementation of the ACA. Give me 1 minute. Your prediction, are things going to get better?
Yes.
Because?
Well, I think things are going to get better because consumers, when faced with having to understand that which they're buying, tend to educate themselves. Look, the rollout has not been smooth. Even the architecture and the mechanics are not particularly good. But if we now all understand that each of us has a greater responsibility to not only take care of ourselves, to avert illness, but to somehow purchase some kind of coverage when we do get sick, I think the collective attention that we're going to spend in evaluating these opportunities is going to make it better. I can't suggest to you that it'll happen next month or next year, to me, this is a generational issue. It's going to take a couple of generations, perhaps, until we get the healthcare delivery system in a form that we'll all be proud of.
Like I said, check out Barry and his ongoing conversations about this topic. That happens often on NJTV News on a regular basis because they cover it, because the changes just keep happening all the time. Because it's a dynamic topic. Barry Ostrowsky, President and Chief Executive Officer of Barnabas Health. Thanks, Barry. Appreciate it.
Pleasure being here.
The games, those games are going to be terrific. We look forward to being there.
It's going to be spectacular.
Good stuff.
Really
Stay with us. We'll be right back right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Aduabto, PhD, and follow us on Twitter at Steve Aduabto.
There she is for the first time on One-on-One, Dr. Sheila Dynan, Dean of the New School of Health Studies at Berkeley College. I only call it new because it's new.
It's new.
Well, what makes it new?
Well, in July of 2013, Dover Business College and Berkeley College merged together, and they brought both of their healthcare programs together under one school, and that's the role that I have taken on as the leader of that school.
So break it down for folks, Dean. If you talk about opportunities in the industry of health studies, give us some examples of what's hot, what's happening, and what it means to the people watching right now on One-on-One.
Well, we're looking at info from the Bureau of Labor Statistics that tell us that healthcare is the growing industry, and there are
it's hot.
It is very hot, and there are certain areas that are growing. We're looking for people to work, patient care, one-on-one patient care. We're looking for medical assistants to go out and work in doctors' offices. We're looking for people who want to do billing and coding, which with the advent of Accountable Care Act is going to be...
Time out. Billing and coding, what the heck does that mean?
Well, it's how doctors and medical practices get paid. And they have to be in a particular format for the federal government to reimburse for Medicare and Medicaid.
Or you're not getting paid.
Or you're not going to get paid.
I would say that's important.
Oh, it's
right,
very
doctor?
important.
Right.
Very important.
That's a career.
Absolutely.
Go ahead.
Absolutely.
And you teach to that.
We teach to that, and people can come in and get their associate's degree on that, and then they can move right on up. We also specialize in making sure that all of our students have the practical internship experiences in all of the areas that they're going out to work in, so they get a true feeling of what those jobs are like. And I would like to make sure that the students that we train become the professionals that the professionals want to hire.
How do you do that?
Well, we make it realistic. Many of our faculty are also practicing clinicians. They have been out there in the world doing these jobs, so they're bringing back the experience and exposing the students to the...
Are we seeing some real life stuff right there, right in that video, that shot? Let's put it right there. Is that what you're talking about?
That's exactly what they're seeing. They have hands-on practice.
Makes a difference.
It does. And in many of the programs, they actually have to do what most people are saying in the industry of competencies. So if they're going to be a phlebotomist, somebody who's going to be drawing blood, they have to prove that they can do a good needle stick without hurting people before they can go on, before they can graduate, or before they can get certified by the accrediting bodies that we use.
Who are the students? Where do they come from?
They come from all over. We have students, we actually have 10 different campuses. Our programs are in 9 of the 10. And we have students coming in from Pennsylvania. We have them coming in from Westchester into New Jersey for certain programs. And we have a great presence in New York City. We have places in Brooklyn. We will be opening up new clinical programs in Newark and Middlesex on July 1.
Doctor, say someone comes in, they have a year and a half, they've worked in a hospital, they've got this clinical background, this training, but they've never actually gone to a higher education institution. Do you have a situation where you say, all right, you have the potential to use some of that practical experience to start with some credits. Can you actually do that?
What we will actually do, we have a couple of formats for that, specifically for people who have that kind of experience and training. One, we have a portfolio system where they can produce for us all of their abilities based on what they've done in life. The other area is that students may come in and take what we call a challenge exam.
Challenge
exam. If they know this material, we'll give them what the credentialing agencies require.
Right.
And they pass the test, we'll give them the credit.
How'd you get into this whole thing?
Well, I've been in education for about 35 years. And I've really varied in many of the things that I have done. Undergraduate-wise, I was health and phys ed, and then proceeded on. And at one point, I was coaching a lot, and was looking at the issues of my athletes, and decided I needed a little bit more background. And I went back and got my master's in social work and became a clinical social worker. And then I did a little part-time work at an emergency room, actually part-time for 10 years, where I was doing psychological evaluations on patients in the emergency room. So it's just a natural fit between what I do as a social worker and what I've always done as a teacher.
So when you think about, when you think about the School of Health Studies today at Berkeley and what a School of Health Studies might have been 10, 15 years ago.
Completely different.
Night and day.
Night and day. And I said to students at orientation earlier in the month that the jobs that they think they're having training for now, that's their starting point. But in 10 years, they will have a different job that hasn't even been invented yet. But they need to get in on that basic level and start to look around and see where the opportunities are growing.
You're not from New Jersey, are you?
No, I'm not.
Where'd you pick up that Boston accent?
In Boston.
Are you a Red Sox fan?
Yes, sir.
And you admit that?
Yes.
Even here in New Jersey?
I do.
We like that.
Yes, sir.
We like that. You don't like the Yankees?
I like the Mets.
Right answer. By the way, your chairman of the board likes the Mets too. Kevin Lewin, you know that?
Yeah.
It's important to know. It's irrelevant to our audience. I just happen to know these things. Dr. Sheila Dynan is dean of it is the School of Health Studies at Berkeley College. Happens to be new because they merged with the Dover Business College, right?
Correct.
And all sorts of possibilities. Dean, I want to thank you for joining us. We love our friends from Boston, and the Yankees will, in fact, be taking back the championship one day, and we'll be smiling, not you guys in Boston, right?
That's fine. We equal opportunity.
Yes, I like that. Thank you, Dean. We'll be back for one-on-one right after this, not talking baseball. Thank you very much.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org. Find us on Facebook at facebook.com/Steve Aduabto, PhD, and follow us on Twitter at Steve Aduabto.
Back by popular demand to explain some things we still don't understand is Jim Albano, our good friend, Vice President, Network Management at Horizon Healthcare Innovations and Horizon Blue Cross Blue Shield, New Jersey. Jim, the reason I'm saying that is we're still trying to make sense of all this, but what I want you to break down for us is Horizon Healthcare Innovations. There are three key pieces to it, right? First piece, patient-centered medical homes. What is it?
Well, so Steve, the real concept behind PCMH, Patient-Centered Medical Home, is that the family practice doctor, the doctor that you would go to for your regular checkups or if you have minor issues, is really the center of all of the care that you receive. We refer to him or her as the quarterback of your care.
Quarterback. Now, all this, folks, if you want to understand what this is about and why we're doing it, it's because it's patient-centered care. It's changing the model of care from what to what?
Very much so, changing the model.
From what to?
Basically, the experience today is a very short, succinct visit around a particular issue. So if you're not feeling well, or maybe even just for a well checkup, that's the current model. PCMH is designed to get at all of the aspects of your health and well-being. And again, that family practice doctor's role is to help you coordinate anything and everything you have to do, including things like exercise, which there might not have been time to have that conversation in the old model where the physician was sort of running from exam room to exam room, trying to get to as many patients as possible.
So Jim, respectfully, where is this doctor getting his time all of a sudden to do this, to have these conversations about exercise, diet, overall health, this holistic conversation? Where's that happening?
Yeah, so
How's it happening?
that's exactly the right question, Steve. Horizon Blue Cross Blue Shield of New Jersey, among lots of other health plans across the country, in developing this model along with the physicians. We didn't do it in a vacuum. We did it with the physician community. We're actually paying an additional reimbursement to physicians to do that care coordination, over and above what we've always paid to those doctors for an exam. We call that a care coordination fee.
A care coordination fee. So we're going to pay you to
basically engage with each and every patient, to understand his or her lifestyle, understand all of the issues and facts around their health, and again, if they need to see a specialist, if they have a cardiac issue, then that family practice doctor will facilitate getting to the right cardiologist.
How do we know, Jim, that this has the potential to have a more positive impact on patient outcomes?
Right. So we're measuring two things in our program, and again, we worked with the docs to develop this, a list of quality metrics, things like preventive screenings, mammographies and colonoscopies, general health and well-being types of things that sometimes get neglected in the old model. We're actually using those as metrics for the PCMHs.
We could go back to that jargon again's throwing me off, that acronym.
The Patient-Centered Medical Homes.
Go ahead.
So we use that for the program, and we pay based on the increases in those instances of screening tests. And we'll pay additional incentive-based compensation to the doctors for increasing those rates.
All right, you ready to confuse things? Oh, you ready for me to try to?
Sure.
All right. ACOs, you did that acronym before for the patient-centered thing?
Right.
ACO stands for?
Accountable Care Organization.
How is this so-called accountable care organizations, which we keep hearing about after the ACA, which is?
The Affordable Care Act.
Otherwise known as?
Obamacare.
What the heck is the connection, Jim? Follow us on this, folks.
Yeah.
I think we're going to need some sort of map. What is the connection between accountable care organizations and everything you just said?
So accountable care and that concept is as you said, in the Affordable Care Act.
What is it?
It's basically
Is it an organization?
It's an organization. It's a separate entity of medical professionals coming together to take full accountability for patient population health.
For example?
So we have ACOs in New Jersey. The Atlantic Health System, as an example, has an ACO. Hackensack has an ACO. There are a number of...
Barnabas has an ACO.
Barnabas
different
has an
people.
ACO.
So why would a hospital have an ACO?
Well, so they're really trying to bring together all of the aspects of care in a single entity. So the full continuum of care, from basic family practice all the way up to the more complicated and serious.
Devil's
things.
advocate, why can't they do it with the regular hospital model?
Because it's fragmented. There is no coordination in the regular model. You might see
coordination of care?
Coordination of care for a particular patient. You might see multiple specialists who never talk to each other. So the entity, bringing the organization together, is designed to have all of those professionals work together. And then Horizon, again, as a health plan that's financing the care, puts in metrics and incentive-based reimbursement based on the outcomes for that particular patient.
Translation. Are you saying that your company, as the biggest in our area, right?
Yes.
You will pay more for those who form these accountable care organizations because you're arguing that the outcomes tend to be better for patients?
It's performance-based compensation. So the better the quality scores, the better the outcomes, and outcomes are measured by things like lower rates of readmission to the hospital for the same condition. So you don't go back
to the hospital for
right.
the same thing you had.
Exactly. So we're gonna reward an ACO that accomplishes that because they've improved the care and experience for that patient.
Okay. So there are three pieces to this so far. I'm going to get to the third. The first piece is the patient-centered medical homes. The second one is ACOs, accountable care organizations. The third, episodes of care.
So that's really putting definition around a particular event in your medical history. So for example, if you need a knee replacement, that's a single event in your life. You don't have usually multiple.
It's an episode.
Right. So what we're trying to do there is today things are very fragmented in terms of you might go to a physician who tells you have to lose weight before we're going to do anything with your knee because that's putting stress on the knee, and we'll pay for that. Then we'll pay for the surgery related to the replacement. And then we'll pay for the rehabilitation or physical therapy afterward. And all of those are separate in today's world. In an episode of care event, we're trying to get to a point where we pay a single amount to that orthopedic surgeon to coordinate all of the pre and post-op care for that particular patient.
The surgeon gets a certain amount.
Right.
And what? The surgeon spreads the money out to whomever?
Well, we help with that process. We, the health plan, Horizon, helps allocate the dollars, but we're trying to put the orthopedic surgeon in the driver's seat.
How does that help the patient?
Well, so if you have a single point of accountability, that individual is watching out for example, to make sure that there aren't too many
that
physical
individual
therapy.
meaning the orthopedic surgeon?
Tries to make sure there aren't too many physical therapy visits, that the right number of visits are applied. And working within a budget, you have motivation to try to control costs in that environment.
But respectfully, Jim, what happens if we find out that in a few seconds, what happens if that patient we find out needs more physical therapy than originally thought because the patient's not recovering as quickly as the orthopedic surgeon thought would happen? I mean, what do you do then?
So then
it didn't work out on the model. The patient needs more.
Right. So that's where Horizon is collaborating with physicians like orthopedic surgeons, and we'll work together with that doctor and allow for additional reimbursement if that's appropriate in that particular patient's case.
Would you agree this is complicated?
Yeah, it is complicated. There's no question about that. Okay. But I think that the key principle in all of this is we're working together as opposed to in a fragmented way.
Reason for hope, but boy, you got to keep doing your own research, and you are your own best advocate by educating yourself. Jim Albano from Horizon, thank you so much for joining us. We appreciate it.
Thank you,
Thanks,
Steve.
buddy.
Appreciate it.
Thank you.
One-on-One with Steve Aduabto has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Aduabto has been provided by New Jersey's credit unions, the New Jersey Education Association, New Jersey Natural Gas, United Water, New Jersey Sharing Network, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Aduabto has been produced in partnership with St. Joseph's Healthcare System.
If you're worried about how the Affordable Care Act affects your Medicare coverage, here are the facts. The Affordable Care Act closes the Medicare donut hole and lowers the cost of prescription drugs for many seniors. Free preventive services are expanded, and copays are eliminated for yearly checkups and important procedures like mammograms. To get all of the facts for free on healthcare reform in New Jersey, call the New Jersey Citizen Action Helpline.